Hi, my name is David Villar. I'm a professor of pharmacology and toxicology at the University of Antioquia in Colombia. Welcome to this video called Preemptive Analgesia that basically refers to the administration of drugs with analgesic activity before a surgical procedure. As we will see in a minute, this is important to reduce the postoperative pain in the animal and make the recovery phase and the outcome of any surgery much better for our patients. So basically, preemptive analgesia denotes the deliberate administration of analgesia before the development of central nervous system hypersensitivity. As I say, it basically is a treatment that is initiated before the surgical procedure in order to reduce the physiological consequences of all those pain signals that originate from the surgical wound from the time of the initial incision until the time that the wound is finally healed and repaired. So why is this important? Well, the reason is that most anesthetic drugs, except for a few ones like ketamine, don't really provide any analgesia. So even when the animal is anesthetized because it's rendered unconscious by the anesthetic, unless we have provided other drugs to achieve a good state of balanced anesthesia, he will probably not be relaxed, will have many unwanted reflexes, and he will continue to process and amplify all those painful signals that are created during the surgical intervention. And basically, the problem is that when he awakes, he's going to perceive all those painful sensations with much greater magnitude than if we had given the analgesic before the surgery even started. So I have included this slide again as a reminder that when we administer an anesthetic, most of the time, we only create a loss of consciousness without the other conditions that are necessary to create what is so-called a state of balanced anesthesia. And as you can see, it includes relief of pain, which is obviously analgesia, good muscle relaxation, and inhibition of most undesirable reflexes. Now, in order to suppress pain, we can intervene in any one of the physiological processes that are involved in producing these painful sensations, and which are nicely represented on this picture here. The first process is the detection in sensory nerve endings, also called nociceptors. These are going to convert all those noxious stimuli, whether they come as a chemical or a mechanical or a thermal signal. They're going to convert those types of energy into an electrical signal, and this is called the transduction process. So next, those sensory nerves will carry out the signal to the spinal cord in the process called transmission. And once they get to the dorsal horn of the spinal cord, the signal is modulated, which basically means that it's either amplified by excitatory mechanisms or the opposite. It's reduced by inhibitory ones. So from here, the signal then travels to the brain, where it's processed and recognized as a painful sensation in what's called the perception process. In other words, the individual becomes aware or conscious and experiences those pain sensations, not only in a physical way, but also emotionally, as we all know, with issues of anxiety, depression, sleep deprivation, and so on. The reason I bring this up is to show you that it's possible to block pain anywhere along the pathway, from the point of origin until it reaches the brain and it's ultimately perceived. So on this other slide, if we look at this slide, it shows the three of the major categories of drugs that we can use as analgesics. We have anti-inflammatory drugs that prevent the formation of those chemical mediators that trigger or stimulate those nociceptors at the site of origin. We then have the local anesthetics that will block the transmission along those peripheral nerves, so it doesn't really reach the spinal cord. And we can also use opioids that will basically work at the level of the spinal cord and the brain. I won't go into the details of their mechanism of action, but as I say, one of the best strategies to control and prevent pain is by using different combinations of drugs that have a different mechanism of action and that basically interrupt more than one of those physiological processes in the pain pathway. This is called balanced or multimodal analgesia. And as I say, the rationale is that pain can be more effectively attacked by targeting different points along the pathway. And another important reason is that when we combine drugs, we need less dose of each one, which also decreases the potential side effects of any one being used. So the analgesics that are shown here in this slide are basically the ones that are used in surgery. And as you can see, they fall into one of these four major categories. So we have the opioids, the alpha-2 adrenergic agonist like xylazine or dexmedetomidine. We have the local anesthetics, and we have the non-steroidal anti-inflammatory drugs. And as you can see, they work in different sites along the pathway. Now, to show you an example of why it's a good idea to use combinations of drugs in these different categories, we can look at this experiment in which they use six dogs in a crossover study design. And the objective was to compare the duration of analgesia between butorphanol, which is an opioid, and medetomidine, which is an alpha-2 adrenergic agonist. So they basically anesthetized the dogs with isoflurane, which is a gas anesthetic that has no analgesic properties whatsoever. And as you can see, when the tail of the animal was clamped or pinched, if you like, the dogs responded immediately when isoflurane was used alone. When they used isoflurane and one dose of butorphanol, the time until the positive response was about 1.5 hours. It was even longer when they used medetomidine instead of butorphanol. It was 2.36 hours. But when they combined the two drugs, the duration of analgesia was much longer than the two of them given alone. It was 5.5 hours. So basically, as I mentioned earlier, the idea of using combinations of drugs that work differently is to achieve a more effective control of pain. And in this case, they also show a much longer duration of the effect, which is also a welcome effect. So going back to the notion of preventive analgesia, the idea is to decrease post-surgical pain and all those unwanted consequences that are associated with it, and that can really undermine the outcome of any surgical procedure. What happens during the injuries that are created in surgery is that the spinal cord is somehow increasing the excitability of those neurons that are receiving those painful signals, and a state of central sensitization or hypersensitivity is created, which is illustrated here in this slide. So another way of looking at this hypersensitivity phenomenon is represented here in this other graph. By default, we could say that the threshold of pain in healthy tissues is usually set at the point that will damage or destroy tissues. So imagine that you put your hand in lukewarm water, which is at 45 degrees centigrade. You can probably tolerate that temperature because it doesn't hurt. But as the temperature of the water rises, you're going to feel increasing pain, which is shown on that normal curve that you see here. Now, when hypersensitivity sets in, the normal curve of pain now moves to the left. So water with a temperature lower than 45 degrees as you can see here, now will cause pain. If the water is at more than 45 degrees, the intensity of that pain that you feel is now going to be higher. So basically, hypersensitivity evokes a state of hyperalgesia. That is, painful stimuli are now amplified in intensity, we could say. And another condition called allodynia, things that were not painful before, now they become painful. So when we apply preemptive analgesia before the surgery starts, this phenomenon of hypersensitivity is not going to occur, as you can see here. And if we compare this other figure with these previous ones, you can see that with hypersensitivity, even regular doses of analgesics will have a hard time controlling post-surgical pain. You will need more analgesics, and it will also take probably many days, if not weeks, for that post-operative pain to go away. So if I had to summarize the ideas of these illustrations, we could say that when you start the analgesic intervention before the surgical procedure, you will need less analgesics later on, and basically the duration of pain will also be much shorter in time and intensity. That's going to translate in a faster recovery and probably discharge from the hospital will also be more rapid, if you like. So if we had to summarize everything and we have to give you a take-home message, this is somehow shown here in this slide. How early is too early to apply preemptive analgesia? We have three befores that can help us remember this whole concept. Before the knife hits the flesh, before the patient hurts, and before the last dose wears off. And when we do this, you will find that the dosage of anesthetic is necessary, not only to induce anesthesia, but also to maintain it, is also much less, which obviously reduces the complications that can always come out when we anesthetize an animal. So having said all this, I hope this information was useful and will serve to highlight something which is quite important in any anesthetic protocol. So thanks again for listening, and bye-bye for now.